Hi, Cindy. Good to see you again.
Hi, Lisa, how are you? Are you back home?
Not too bad.
bad.
Yes, I am.
Hi, Jonathan.
Hello.
Deborah.
Hello.
Hi. Hi, Nora. I know one person's not going to be able to make it. That's Julie. She's traveling.
Okay.
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 Michelle.
Oh, hello, everyone. Oh, Jonathan, you're in here. Are you helping us today?
This is my group, I was told.
Yeah, you're the only guy.
Wonderful.
Well, all this
Masculinity.
beautiful Shakti power.
Yeah.
I'll just absorb it.
Exactly.
Hello, everyone.
Hello.
Hi, Dr. Ashwini.
Namaste.
Hello.
Namaste.
Yes. I hope everyone is there. Okay, simply these are. Who is missing?
I know that Julie will be missing. She said she was traveling.
Okay. Okay.
So-
Anyone else?
Is Mia here?
No, Mia is also not here.
Not here yet. No.
And Kelly, maybe?
No.
Yeah. So, any idea whether they are joining or not?
I didn't hear.
I didn't hear back from Mia, so I'm not sure.
Okay. Okay.
Yeah, me either. From Kelly.
Okay. Hi, Jonathan. Nice to see you.
Hey, Dr. Ashwini, good to see you too.
Same here. Thank you.
Do we have
Okay.
a WhatsApp group? I don't seem to be on it.
Yes.
Yeah, I think you haven't joined it, Jonathan.
I haven't. Unfortunately, personal family things have caused me to be a
Okay.
little behind. I'm catching up today, so I'm not sure. I didn't know which group I was in until I was assigned, so I don't know how to join it.
I think Alma is also not there, right, Cindy? Alma?
Yeah. I think I can go in, right, and invite him through the WhatsApp, maybe?
Yeah. Yes.
Oh, I'll
would
do
be
that,
good
Jonathan.
idea. Yes.
Sure.
So that we can start. I think.
So is it being recorded right now?
I am.
Yes. Yes.
Because, yeah, Cindy,
Yeah.
you're taking care of that?
Uh-huh.
Okay, great.
I'm practicing.
Yeah.
Okay. We'll just wait for 2 minutes. Cindy, you are texting to them, right? On the WhatsApp group?
Yes, I will do that. I just have to find my.
I just sent a note to Kelly too privately.
And just quick before we get started, Dr. Ashwini, I take it you saw my little message from yesterday?
Yes. Yes. I'm going to reply you.
Okay, good.
Basically,
Just
this.
hoping that we can chat about
yeah.
that for a few minutes at some point.
Yes. Yes.
just gotta-
Friday, Saturday, and Sunday are busy clinics for me. So I'm going to reply you after this call.
Okay. Oh, thank you.
Yes.
Kelly just said she's at work, so she won't be able to come on. She'll
Okay.
watch the
Okay. Okay. So shall we start?
Mhm.
Okay. So basically, with this meeting, we are going to discuss some case studies. Basically, why we are discussing this case study, that we are doing these video consultations, and those who are present during the consultations, they don't know what exactly they have to learn from that consultation. So here I am first sharing with you few of my cases. These cases are during this February month only. And as you have studied in the sessions that Vata, Pitta, and Kapha, that 3 dosha, and we are going to take case studies on each one of these dosha, so that you come to know that what exactly we have to understand with this aggravated Vata, Pitta, and Kapha, and what questions you have to ask regarding while doing the case studies, while taking the history. Okay. So basically this February month is very blessed month for me in my practice. Today only I know about the one of my infertility patient. We are blessed with the 3 baby girl in the month, my infertility success cases, and 3 of them blessed with baby girl in the same month. So I'm very happy and satisfied with that. This month is blessed one with in our culture we called it as a goddess of Lakshmi, that prosperity is coming to our home when you blessed with a baby girl. Okay, so I'm very happy that while treating the infertility case, it's a very difficult journey because lots of hopes from the patient, the couple, and you are the mediator between the nature and the couple. Okay, so in treating the infertility is one of my area of interest. So here I am sharing these cases with you. So I'm going to share these 3 of the cases. The first case is of a normal hormonal imbalance case, along with the PCOD, and they are trying to conceive since last 4 to 6 months, 4 to 6 years, sorry. So when we treat the infertility, we have to keep note always that which dosha is imbalanced, which hormones we have to treat, and how to regulate the cycle. To regulate the cycle is one of the major tasks while treating the infertility cases. So in this PCOD case, when it comes to me, and they did all the allopathy treatments, that OC pills and everything they are taking, and all the side effects they have, the female have. So first I have to do the complete detoxification process for her. Then after this detoxification, within 2 to 3 cycles, her hormones gets balanced, and in the 4th cycle, she get conceived. Okay. Now I just want to tell you that once your infertility case is success, we can't let it go as it is. As per Ayurveda, the whole 9 months we are doing uh, a, a different treatment. As per Ayurveda, every month each organ or each factor is growing, and as per that we are treating the patient, we are helping, supporting along with allopathy medicines, so that the next generation, the baby who is going to born, will be healthy with a great immunity and many of the factors for the good health and everything. Okay, so we are taking care of each factor, like skin, like hair, everything we can cover during these 9 months of treatment. So all the 3 are with me for last almost 1.5 years while treating their case, and now they are happy parents. Okay. The second infertility case is which actually conceived through IVF, but before this successful IVF, she had 3 unsuccessful IVF cycles, and the depression, then anxiety, everything was there. And due to this IVF cycles, she has lots of water retention, swelling, everything is there. That pitta is high, heat is there because of the hormonal therapy they have done during the IVF cycles. So again, we did this complete detoxification process for her. And after detoxification, during the detoxification only, she feels that there is changes in her body. The heat is going out, expelling out from her body. She feels refreshed because back-to-back IVF cycles turn on her health. Even she can't even there is a lot of ama in her pulse while I first saw the pulse, and which is not good for the pregnancy to continue. Okay, so the whole detoxification process has been done for her. The only thing is that her IVF specialist told their this couple that they can't conceive with their own eggs and the sperm. So this is again difficult for them to absorb the things. And that's why they find the solution. They want to find the solution through the Ayurveda. So after detoxification, Ayushakti has some herbs that can increase the quality of the herb, quality of the eggs as well as the sperm. So the first thing, see, when I see the pulse, I find that there is a lot of heat and pitta aggravated in her body. This heat and pitta is actually hampers the quality of the eggs. So that's why the back-to-back 3 IVF cycles are failed. So when these IVF specialists are not taking care of the quality of the egg, and as you learn in the sessions that Shukra Dhatu has to be optimum level when you are planning for a pregnancy. So we work on this Shukra Dhatu. I'm explaining you because just now you have learned all these things in your sessions. So importance of Shukra Dhatu. So to improve the quality of the Shukra Dhatu, we have to do this whole detoxification process. Then in the Rasayana therapy, we have to give lots of the increased dose of some herbal formulation, which increase the quality of eggs as well as sperm. And finally, when they go for the next IVF cycle, their IVF specialists agree that, yes, we can try with your eggs because the quality is good now. So their wish come true and their dream come true that they can conceive with their own eggs and sperm. So I feel very happy and satisfied that I can be, or actually I'm blessed to be a part of their parenthood. Yesterday only they messaged me that we are blessed with baby girl, and oh, I can sleep very sound. I have a sound sleep yesterday. Because when you are with them through this journey, you are attached to them. Everything, whatever they are facing, they are always, they have this mind that yes, Dr. Ashwini is always there for us to take care. And whatever problem, a small problem they are facing during this 9 months journey, and they are happy to share, and the end result is very satisfactory. Okay. So this infertility area is very close to my heart, and I'm very happy to share this story. That's why I'm sharing this. And the most important thing is this Shukra Dhatu in these cases, that Pitta and heat things that you have to work on like that. Okay. So this is one sharing with you. Now we are going to take the next 3 case studies for the aggravated vata, aggravated pitta, and aggravated kapha. So just listen carefully how we have to ask questions while treating this kind of patients. Okay, so first case study of aggravated vata. This lady come to me in the clinic because when she came, she is supported by her son as well as our staff, because she waited for a long time in the waiting room, and she unable to get up from the chair. Someone has to support her, and then she came to us. While I first saw her pulse, there is a definitely aggravated vata in her lower body, and a lot of stiffness in her lower body. So when I ask her that, do you have a lot of pain in her lower body? She says, no, I don't have any pain. Okay. Then I have to recheck the pulse that there is a hamper has affected circulation in her lower body. So when I go deeper, I feel that there is an obstruction in her pulse, in the vata pulse, basically. So when this vata pulse has an obstruction and hampers the circulation, that means there is some vertebra, lumbar vertebra problem. And you can feel when you learn the pulse reading, all these things will come. But I'm just explaining that there is a disc bulge in her L4, L5, and the nerve is pinching. So when while doing the video consultation, we are asking related to the aggravated vata condition, that whether there is a pain in your lower body or any joint, whether there is a stiffness in your joint, Whether there is any muscle spasm in your joint, okay, any calf muscle spasm or something like that, so that you come to know that there is a aggravated vata in the lower body. Again, when you come to any cervical related case, is there any stiffness in your neck and shoulder? Is there any movement restriction? When you come to know that there is a movement restriction, that means there is some muscle spasm in that joint as well as surrounded muscles. And when it comes to this joint and muscle stiffness, there must be ama in that pulse. So you have to ask accordingly. So when you have a this type of case, you have to ask whether there is regarding the digestion of the patient, whether they have the acidity related problem, bloating, or any this constipation, everything. Okay, so from that you come to know that yes, this is the patient has ama, the patient has aggravated vata. What type of? Yes, when the patient says, this patient says, I don't have any pain, but while this patient have the numbness and tingling sensation in her lower legs, she can't even walk due to this numbness and tingling. So this particular question you have to ask, that whether there is a tingling or numbness, and then you come to know that there is some nerve pinching in her vertebra, lower body vertebra, and you have to work on that. So while planning for this patient, we have to control the aggravated vata, particularly lower body vata, to release the stiffness in the lower body with reducing ama, and the third one, to give strength to that nerve, the nerve which is pinching and not circulating properly. So we have to give strength to that nerve. This patient is actually planned operation, orthopedic suggested operation of the disc, and they want to cut the things and release the nerve. But we have seen the patient that with this type of operation, if they are not successful, the patient can be bedridden for the whole life. So I advise them that at least before going for operation, try this detoxification process. We have Arthrox process for this type of vata aggravated patients. So we do the whole thing, actually the complete detox process. Then we start with this spinal dhara treatment for this patient. First, we release the whole muscle spasm of the lower body. Then start with this spinal dhara and steam, so that we can lubricate the whole spine. And when you lubricate the whole spine, the pinching of nerve, the pressure on the nerve gets released and the circulation starts. Yes. Today only I do the follow-up with the patient. She's almost 60 to 70% relief, and she can feel that sensation in her legs. Her tingling sensation is almost 80% gone, and now she can walk normally. There's still that 20 to 25% improvement we are waiting, because the nerve strength has to be regained. Okay, so this is the case of aggravated vata. Here you have to ask the particular questions about the ama, about the spasm in the lower body, about the nerve pinching, tingling, numbness sensation. So these are the important questions that you have to ask when patient is complaining about the lower back pain. So not only the pain, this tingling, numbness, everything you have to ask while patient is complaining the pain or the tingling, numbness thing. So this is the case of aggravated vata. Any question you have until this? Anybody?
I have a quick question. Is there kind of like, until we get really used to all of this, is there like a bit of a flow chart? So, for example, okay, questions to ask to determine if it's aggravated vata, go along this
Yes, it will
path.
come in the, it will definitely come in the sessions while you are learning. But if you have any questions, we can prepare a chart for this. Okay.
Mhm.
Okay. Anyone else?
Dr. Ashwani, did you use something like the Healthy Me Detox, or did you do Panchakarma?
No,
or
Panchakarma. This case
did
is a
Panchakarma?
Panchakarma, not healthy me detox.
Okay, I was gonna say, so there's a whole bunch. What about when in the Panchakarma, you know how they do those different marmas when people are having musculoskeletal stuff? Is that part of Panchakarma, or is that something entirely different?
No, it's a part of Panchakarma only.
Okay,
Yes. When there is, when you do the massages, you feel
Mhm.
that there is some blockages or muscle points that you have to release. When you listen to these marma sessions, you come to know that yes, you can feel that knots. We called it as a knots, and we have to release that knots so that this muscle get relaxed. Okay, and to releasing these knots is a technique actually.
okay.
Okay.
Thank
Yes. Welcome. Okay. So now we are moving towards the pitta aggravated case. One of my patient actually asked me this question that, doctor, do you do a 24-year-old guy can have a hypertension? Okay. So I feel why he's asking. Like, my one of my friend is having a hypertension at the age of 24. So I asked him, yes, it can happen. A person can have hypertension, but so that guy asked me that he don't want to take these antihypertensive medicines because if he starts now, then it will be a for lifelong for him. So can you help that guy? Okay, let him come and consult me and let's see what exactly happened. So this is the case actually misguided for the anxiety and antihypertension. Okay, so this guy is a 24-year-old guy, and he's a something IT consultant, continuously doing the work which requires this sitting, and nowadays the work from home, a long sitting, long duration of sitting, and having munching anything, any junk food. He's every day he's munching the aerated drinks, he's having this pizza, burger, which is not good for his health. Okay. And he is a rider. So on weekends, he do a bike riding. And when he come to me, this guy came with a bunch of files. And before come to me, he also went to his physician and he did his fifth ECG, fifth ecardiogram, and which is saying there is no issue with his heart. Okay. So this is the fifth time he is doing this echocardiogram, and he is continuously in the fear that he is getting the heart attack at the age of 24. And very I can feel that anxiety on his face on his, when he is coming to me, on his body language, with his body language. Okay, so I asked him a question about his lifestyle, what he is doing, at what time he is getting up, what he is having first thing in the morning, what type of food he is having, like that. So this guy particularly has a aggravated pitta, his digestion is not good. And he actually has this hyperacidity, and because of the bloating and gases, this vata is moving upward along with this pitta. And as he is a biker, he has this left-sided some muscle stiffness. When this vata goes up, he is having tingling sensation while riding the bike in his left arm. So this guy is misdiagnosed that he left-sided of this tingling sensation and this hyperacidity as a heart-related issue. Okay. So when I come to know with the pulse that he has a very high level of pitta in his pulse, and after taking the history, he is having uh, this fermented food, that in India we have this fermented morning breakfast like idli, dosa, like that. It is overnight fermented and then they prepare the pancake or like that. So he's having every day that snacks from outside. He's ordering from Swiggy. Even for the breakfast, he's having this pizza burger, which is having a lot of cheese and the tomato ketchup particularly. And for the dinner, maybe a Chinese thing. So it also has the this Chinese sausages and everything. Hmm? And he's sleeping late. So because of the late sleeping and this type of food, his pitta gets aggravated. He's continuously sitting. There is no activity. On weekends also, he is riding the bike only. So he's having a lot of gases as well as bloating. Hmm? And he is constipated because of this bad food habit and low movements, no exercise. He's having the constipation. Drinking only these aerated drinks, not having a water, is also create a constipation. Okay, so again, I listened to the whole lifestyle. Hmm? And the stress he's having in his office work, that is also causes this anxiety. So every time he has some project or delivering of the project, he has this heart related issue. And that's why the whole work is also hampering. And his physician started some anti-anxiety as well as a mild dose of antihypertensive medicine, though his BP is not actually raising up to the 140 or 150. Okay, because of the pulse, this pitta, he feels that headache also. So again, he feels that because of the increased high blood pressure, he is having the headache. So the whole thing is actually getting misdiagnosed one by one, and hence he landed up in a antihypertensive medicine. So again, I counsel him that these are the things because of your wrong lifestyle. These are the things which aggravates your vata. This creates a indigestion, and that's why you are having this problem. So this young generation, they are not very believer of Ayurveda, but you have to counsel them again and again. After that, in the next follow-up, he came with his sister, and then both of us again counsel him that this is the wrong lifestyle, is causing your problem. This is not a heart related issue. Okay, so this is the guy. He then trust me and started doing the medication. We already started the medication, but I'm very keen that he should do the detoxification because he have all the garbage with this junk food in his appetite. So to get a good result and to believe in Ayurveda, I let him do the detoxification process. Again, we do this Virechan karma, that purgation actually, purgation process, that Virechan. And yes, he once he start getting the result, he start believing on us. He start believing Ayurveda. And then he start following. Okay, now I'm not going to cheat in my diet, and I'm following whatever you are advising me. And yes, after that, after the completion of the detox process, he absolutely, there is no acidity. He can eat a normal food and not taking. Anyways, he just started a 1 week of antihypertension medicine and he himself stopped it. No, I'm not going to take this because I know that these are not good for me. Okay, he stopped the all allopathy medicine because whenever he has his acidity problem, he pop up with the antacid, and this antacid actually suppressing his digestion. As we called this Agni, the digestive fire is basically suppressed when you are popping up antacids regular basis. Okay, so he feel that, he's on the follow-up call, he said that first time after so long years, I feel that I am having appetite, or I am hungry. Actually, I am hungry. That, so this feeling of hunger is not there for so long for him. And that's why I'm trying to explain him that whenever you feel hungry, then only you have food. It's not just there is a time to have a lunch or time to have a dinner, that you just munch on the food, which is also not healthy. Okay, so yes, I'm happy in that case that I can help him to misdiagnosed for the heart disease by taking the allopathy medication. And yes, this is the thing, this young generation who start believing in Ayurveda, after that, his 4 to 5 colleagues comes to me for the almost same problem. So this is what we want, that yes, we are in India, the elderly people believes in Ayurveda, but this young generation, they want a quick result. They want a quick solution for their problem. They don't want to follow the diet, but this is the guy who is doing like the what I can say, a mouth publicity that yes, you can meet this doctor and you will get a solution for your health problems. So yes, I'm happy that this young generation can also support Ayurveda now. So this is also one of the interesting case of the February month. And yes, any question in that?
And then mute. Okay, Dr. Ashwini, I have a question. So
Yes.
the case we were talking about was elevated pitta. So we were
Pitta.
talking about, so that must be, is that like his constitution was pitta? Because you were saying his
No.
diet was aggravating his vata.
His constitution is also a pitta. So
Okay.
this diet is actually adding on to aggravate his pitta. So it's
Okay.
easy for him. It's easy that this aggravation of pitta is easy in the pitta constitution person. So if it is already there, if you add
Okay.
on the pitta aggravated food and the lifestyle, it jumps up like anything. So that's why it's moving upwards till that tingling and everything. Okay.
Okay, so those were all, that was all the pitta. So you said something about vata was being aggravated and was pushing from his stomach up to his heart.
Yes, vata is because of his indigestion. It creates a gaseous bloating and it moves upwards.
Okay, and then they get the symptoms like their cardiac symptoms.
Cardiac symptoms, yes.
So was the numbness in his arm from the vata aggravation, from
Yes.
the indigestion?
Yes, this is because of vata aggravation.
Okay. Someday I
Okay.
may actually understand this.
Okay. Anyone
Okay.
else? No questions?
No, Deborah took my question. I was
Okay.
curious how the Vata and Pitta were, interacting with each other to, I guess, create symptoms and maybe make one worse when one increases. So I'm guessing
Yes.
that they all kind of work together to make things better and or worse.
Yes, yes, yes. There are combinations of that. You may have, in one case only, you have aggravated vata, aggravated pitta, and aggravated kapha also. Okay. So there may be a combination because nowadays we are having not a single symptom. They have a bunch of symptoms at a time and they want to treat it but there is actually a connection of this. As I'm saying that because of the indigestion, why this indigestion? Because his pitta is not good. His agni is low, hence he has an indigestion. Okay, because of the food, pitta is aggravated. This vata is accompanying him and moving upwards. It's like that. So yes, this is a pathophysiology of each and every disease that you will come to know in further sessions, that how to break this pathophysiology and how to treat this. Okay.
Yeah, and I'm thinking, well, even with myself, I'm a born skeptic, and you're talking about this patient. It wasn't until he really started seeing results that he really was like, okay, this works. So his mindset finally changed. So I'm
Yes.
thinking there's like certain things that even though maybe addressing a certain symptom may not be overall the best thing for someone's health, it might give them immediate result to get that mental buy-in and be like, hey, this works. So is there sort of known things that like, hey, this is a quick fix to kind of let the patient know, hey, you can see some results, and then from there
Yes.
you can go into the deeper things?
Yes, yes. So here comes to the actual role of what you are prescribing for the patient. So the accurate prescription of herbs is very important in this case, because if I'm prescribing him for 15 days medicine, because I'm doing follow-up every 15 days. So within that 15 days, I have to work on his digestion, that at least his digestion should improve, his Agni should increase, and along with that, his production of pitta should control the aggravated pitta. So if I prescribe this type of herbs and make changes in his diet, this type of quick results happens. Okay. So the accurate prescription plays a major role to give a quick fix, and they will start believing the things that yes, I'm getting the things. In his case, I told him that you are having antacid on regularly. Okay, so our herbs will start working. So after 4 to 5 days or 7 days later, you start skipping the antacid. Whenever you feel that, oh, there is a heartburn, there is a hyperacidity, reflux, you anytime you can have that antacid. Okay, but at least try to skip this. And when he came for a follow-up, he only took 2 antacid within these 15 days. So he come to know that he is having the result. Okay. So this type of things we have to work. Okay. Should I move for the aggravated kapha?
So Dr. Ashwani, I just want to clarify this because I don't know if I heard it correctly. You said he noticed he only needed 2 antacids, but I thought you were telling him not to take the antacids, or did you tell him when he needed it to go ahead and take it, and then he noticed the difference and he didn't need it as much?
Yes, yes, yes. I told him that in case of emergency, whenever you need it, then take the antacids. Otherwise,
Okay.
no. These herbs are working for you. Okay, so
Okay.
within that 15 days, so out of 15 days, he's having only 2 days of
But
antacids.
he really needed it. Okay.
Yes, yes. Yeah. Okay. So yes, the third case is again a 44-year-old guy. And he came with reference only from his friend from office. And this guy is having a bronchial asthma issue. Okay. So last 15 years, he is taking bronchodilators of that pump of furocort and minimum 4 times a day. I'm saying minimum 4 times a day. That means if he requires, he's actually had almost 7 to 8 times a day also. So yes, and this type of severe asthma he is having. So it starts with first the sneezing, continuous cold, and then he feels like shortness of breath. His morning start with the running nose, nasal blockage, and a continuous sneezing. And slowly it turns out into a shortness of breath. So last 15 years, he is treating by a chest physician and just changing the bronchodilators, which are working for him. And every time the chest physician is taking his PFT test, that pulmonary test, that how much lung capacity is having, because actually he's only breathing on the bronchodilators. So in case of bronchial asthma, there is a constriction of alveoli. So the inhale and exhale is not complete. And because of this constriction, you need some bronchodilators so that this gets dilated, the alveoli gets dilated, and then you can start breathing. Okay. So this guy is taking high level of bronchodilators since last 15 years. When he come to us, basically he is from South India. And South India, there are few dietary habits that he is following. And that's why he's facing this problem. Anyways, this bronchial asthma is there in his family. His mother is having the same thing. Okay. So he feels that, okay, let it be. Now what happens? He, at the age of 44, he is having the lower back issue as well as the knee problem. And the doctor diagnosed that you are having this osteoporosis. So he become very, what I can say, he was very low for a month that, okay, already I have asthma and now I am having the osteoporosis also. So at the age of 44, then how can I live the entire life? Hmm? So when he come to us, he's having the whole bunch of this PFT reports and the prescription of his chest physician and everything. So again, we do case history for him, and this coughing, that the symptom of the running nose in the morning, the getting nasal congestion. When I take the pulse, there is a high level of kapha. There is a chest congestion in his kapha pulse. Okay. And I can feel that the lung capacity is very low, so that he needs that bronchodilator. Hmm? So we start taking the history. I come to know that he is having, as he is constipated many of the times, he is having a lot of water first thing in the morning to clear his bowel. Okay, this is the first thing. The second one, he is having to maintain the weight. He is having a milkshake or smoothie with the milk, that different types of fruits. He is mixing with some protein powder and the milk and having the smoothie for the breakfast. The third thing, he is very fond, as he is from the South India, he is very fond of the coconut water. So almost 2 to 3 times a week he is having sipping. So he feels that I'm not having any aerated drinks or this Coca or this Coca-Cola or all the aerated drinks he's having. I'm having a natural drink, that is the coconut water. So it must be healthy. This is the third thing he told me to have. And the he's again, is very fond of the yogurt, that we curd and the dairy products. So every night he's having a milk before going to sleep. So when I come to know all these things, that you are creating a problem to yourself by aggravating the kapha. So he's saying, I am taking a treatment from last 15 years. No allopathy doctors told me about this, that these are causing your problem. Okay. So here we are the actual, what we can do for him, that in his case, we have to control the production of mucus as well as kapha. So these, whatever the things I told you, that this morning, lots of water, that smoothie with milk, nighttime milk, this yogurt thing, all are kapha aggravating. Okay. And again, he is also doing work from home, no movement at all, no exercise at all. So this is also aggravates, or it also aggravates the kapha in your body. So here in his case, we have to control the kapha by controlling his food habits. We have to work on the lung capacity, that we have this breathe easy nasya. One more thing I just forgot to tell you, when I saw his nose while doing the consultation, there is a nasal polyp inside his nose. So his nose get almost blocked. There is no inhale and exhale completely. So again, I have to focus on this factor, that there should be a reduction in this nasal polyps, so that he can inhale at least 3/4 of the air every breath. Okay. So we started the medicine, and yes, this type of 15 years old chronic case, to control the kapha, we do the detoxification. We called it as a asthatox treatment. And the goal is to stop his bronchodilator, to stop his pump. Okay. It takes almost 6 months for me to reduce his pump, because it's not like that he is taking 5 to 6 times a day, then it comes to 3 times a day, then it comes to 2 times a day. And now, from almost 2 months, last 2 months, he's not taking any pump, and he is only on Ayushakti herbs. And no morning sneezing, no runny nose, because the causes creating this kapha that we remove from his life, that from the restricting the food and not having a particular kapha aggravating food. Okay. Also with that, we work on his polyp. We have a treatment called a Nasya treatment. So he, during the detox here at clinics, we are doing it. Then I teach him how to do it at home. He's doing it regularly, and the polyp size is almost negligible. There is no polyp in one nostril. There is no polyp. One he still have. So he can inhale a complete air and exhale because of the reduction in the polyp. Okay. And now he's completely off the bronchodilator. He wrote a very good testimonial for me that I owe my every breath to you because I don't know how to breathe naturally. And he now started to go for a running. He started cycling. He's regularly practicing yoga, that deep breathing exercises, anulom vilom pranayam, and he's super happy. He can feel, he says that there is no chest congestion and I can feel the lungs, the air entry in my lungs for the first time. So yes, see, with this type of chronic cases also can treat if we take a good history, and if we remove the food items from his daily routine, which aggravates the kapha. And when here, actually in Ayurveda, it's called as a to remove the causative factors in the first phase, you can get the result, 50% of result there only. Okay. So we called it as a Nidana Parivarjanam. It will come in your session. So the causative factor has to be removed from the list, and 50% of result is already there. The rest of the things will be done by these herbs and the exercises and this anulom vilom deep breathing things that guy is practicing. So this is the case of kapha aggravation. So anything else, any questions in this case study?
I have 2 questions, Dr. Ashwini.
Yes, David.
One, did you start the exercise after the detox? Or
After
did you
the
start
detox.
after the detox? Okay.
After that.
And then,
See, to start exercising for him, his breathing should be good. And he's
Okay.
having this nasal polyp. So he can't do the deep breathing exercises until this polyp gets reduced. So he started after detox.
All right. And then another question I feel silly asking, but I need to know, what was wrong with the coconut water?
Okay, coconut water is very cool in the properties, and it's
Very what?
aggravate,
I'm sorry.
very, very cool in property.
Okay.
It has a Shita Guna. You will come to know in the sessions, Shita Guna, cool property. And anything cool which aggravates the kapha.
Oh, okay. I would have never thought. Okay. I guess I
Okay.
got a lot more to learn.
Okay. One point I missed here. He is having the normal water first thing in the morning to cleanse his bowel. Okay. So when you have a indigestion issue, not clearing your bowel movements first thing in the morning, as per Ayurveda, we say that if you can't digest the food, you can't digest the water also. Okay. So this undigested water comes, or the body is throwing outside with this running nose, this sneezing, like thing. Okay. Yes. So the water is also has to be digested.
Question.
That make,
Oh, okay, so in this case, if you can't have water first thing in the morning, what would a person that has the aggravated kapha take in the morning?
Okay, so he should limit the water. For
Mhm.
example, instead of having 2 to 3 glasses of water to cleanse the bowel, take a half glass or 1 glass of warm water with the pinch of turmeric. These are the home remedies that I have prescribed to him. And anyways, there will be a herb that cleans the bowel. So no
Okay.
need of taking 2 to 3 glasses of water
Okay.
to cleanse the
Okay.
yeah.
Okay, I understand. Okay, and then
Yeah.
also, do you ever run into issues? Obviously they're working with doctors, right? Allopathic doctors.
Yeah.
And do people kind of resist you sometimes because they're like, but my doctor said, I mean, or are they finally at the point where they're looking for something else because they don't like, what's happening?
Okay. Yeah, people resist sometimes, but
Yeah.
as I told you, when this come to see the results, yes, this is helping me, then they start believing on you.
Right, that kind of goes back to what Jonathan said. If you can get
Yes,
a result early on, then, okay.
yes.
Okay.
So when I do the nasya, he feel that he can inhale a good air.
Mhm.
So he come to know that because before that he did that nasal surgery for deviated nasal septum,
Yeah.
and there is no use. There is again a polyformation,
Okay,
and he can feel that breathing. That yes, this is a improvement in the breathing,
okay,
and there is with this stopping having the water in the morning, and when I stopped his coconut water, the running nose is completely not there.
okay,
Okay, so he
Okay.
feel that, yes.
Yeah.
Otherwise, he has to take that anti-allergic pills every day, night, that levocetirizine or something like that. And it suppresses the thing. It's just an anti-allergic. It is not curing you.
right,
So this has to be again and again, we have to emphasize that this is not a cure for you. This is just a suppression.
got it.
Okay.
Yeah,
So
thank you.
if you are not changing the things in your food, in your lifestyle, this is not going to cure. And that's why you are ending up taking these 4 to 5 times of bronchodilators.
I have
So
a daughter.
again,
Yeah, I have a daughter who
Okay.
is taking a lot of
Then-
that. So this is good for me to
Okay.
kind of.
Okay. And this bronchodilator has a side effect of osteoarthritis, that osteoporosis.
I'm gonna
So
let her know.
it is weakening your bone. So when you tell this type of connection to them, they come to know that, yes, this is what exactly happening.
Yeah.
So this type of communication should be there.
Yep,
Okay.
okay, thank you.
Dr. Ashwini, it sounds
Yes.
like just in this particular case, but maybe I'm just reading into it, that this person really didn't have bronchial asthma, just the air was not getting to his lungs. Is that right?
No, it's a case of bronchial asthma because his PFT test showing that there is a decreased lung capacity.
Okay, okay.
Yeah.
It just sounds like his lungs weren't receiving the air and
Yes,
therefore the
yes.
capacity was diminished, right?
Yes.
Okay, thank you.
right, but you were saying the alveoli wasn't fully expanding because of this mucus, because of increased kapha.
Yes,
Oh,
yes,
Is that right?
yes. And that's why we did this detox. Yes, we did this detox that start melting this kapha and it expel out through the purgation process.
I had a question about the nasal polyp. And did you say you did a nasal wash?
It's not a nasal wash. We called it as a nasya treatment. It's a oil drops installation in your nose.
Okay, I was wondering if that was like a neti pot thing, because I've used a neti pot too to kind of help clear things out. So I was curious.
No, it's something different.
Okay. Hmm. I'm curious.
I was-
I have nasal problems too. I thought
Okay.
maybe I have a deviated septum or something. Because sometimes it'll switch on me, so I don't know what's going on. I have to take a daily allergy, so I'm very
Okay.
interested.
Okay. Good. Anyone else?
Dr. Ashwani, on the asthma, have you seen that there's an emotional aspect to the asthma, or is that just part of the constitution?
Uh,
Like stress and emotional stuff triggers, or is it mostly physical in
no,
your
it's
experience?
in his case, it's a physical thing, not so emotional relation. Yes, but there can be an emotional thing in some cases. Okay, I don't know how much time we have. So, okay, now you people tell me. I hope you get some informative stuff in these cases, and it helps you to understand the importance of case history, because those who did a consultation and received the email, you can find that I have written a general dietary guideline. So here we have to focus while writing the prescription. I have to focus on few things, that if at least these general guidelines you follow, there will be no production of AMA. Okay, so we first restrict the gluten intake and gives the substitute like amaranth, ryan, kamut, like that. Though this any type of gluten creates AMA in your body. Okay, then the fermented food that I restrict almost for every patient, or the sour fruit, which actually creates AMA if your digestion is not good. And it also aggravates the pitta. So the lemon, tamarind, pickles, aerated drink, the sour fruits like oranges, pineapples, berries, sweet lime, all these are aggravating vata. In case of kapha cases, I no dairy thing, because dairy again aggravates the ama if your digestion is not good and aggravates the kapha. No red meat in that prescription. No red meat, because the same thing. If it is not getting digested completely, because it's heavy to digest, and if your agni is low, it is not getting completely digested, it creates ama in your body. So these are the few general dietary guidelines. If you're, anyways, when the patient come to us, there is a digestion issue, there is aggravated of something like that. So I prepare this general dietary guideline, so that at least, so as per the patient's need, I revise the thing. For example, if a patient of skin problem comes to me, then I write something different, that there should not be a milk and fruit combination or milk and salt combination. So these are a particular for any this type of particular diagnosis. But otherwise, the general dietary guidelines I have prepared in my prescription. So you at least give this type of advice in the first phase of your learning, so people come to know that, and always give the reason to them why you are restricting this sour fruits, why you are restricting this fermented food. Okay, so when you give the reason, then and then only people are going to listen you and going to follow you. Otherwise they are not going to listen to you. Okay, this is what I actually prefer while I'm practicing. Yes. Anything else you need to discuss?
I have a question. So when we
Okay.
bring a person to you and we're taking our notes, are we supposed to be sharing those notes with you that we're taking, or are they just for us, or, you know?
You can share, and if you have now you come to know that what exactly why I'm asking these questions.
Okay. Okay.
So now you can also start thinking like that. Oh, if she's asking that if there is a spasm, that means she is thinking about the ama and vata.
Got it.
If she is asking this digestion related thing, that means there is definitely something like pitta. So
Okay.
see, here we are doing the video consultation, so I have to ask all these questions. Okay, otherwise when we are taking the pulse, we come to know that yes, this is the thing which is aggravated. So we have to ask a less question in that sessions.
Sure. Okay,
We
thank
just
you.
have to confirm our diagnosis. Yes, with the
Okay.
pulse, asking the questions.
Thank you.
Okay. So I think we have done almost. Anyone want to share their experience or any case related thing you can share?
So I have a question for you because I may have made a bad choice. I know one of the people that I had said they wanted to do a session with you had called and said that it was Andrew, and he said all of a sudden he had that pain in his leg and it was acute. Well,
Yes.
since I knew nothing about the sessions, I said, well, maybe you should go ahead and do the session anyway, because maybe she has a solution. Because I'm thinking, well, you might have a mama or something to help him. But instead, we
Yeah.
let him do the acute treatment with the doctor and then give him his prescription on the back end. So if
Yes.
somebody's having an acute flare up and in crisis, is
Yes.
it better not
Yes.
to do the initial
Yes.
consultation?
Yes.
Okay, so
After
hold
that,
on,
you
tell
can-
them, let's reschedule it to when you're stable or better.
Yeah.
Okay.
See, in case of severe pain, until and unless you have a practice marma, a good practice of marma, you can't do anything. And
Okay,
even while doing the marma, if there is a stiffness or there is some nerve issue, and if you press a wrong point, then it will not help you, or it may aggravate the pain. So it's not that emergency. Only a trained one can do this type of thing in the emergency cases.
okay,
Okay. So that's why I told him to visit an emergency room, and I will do a prescription later. And if there is something like fracture or something like that, you can't do anything in that case.
okay.
Okay.
I wonder if this is like a one-way street, because for about 2 years I've been doing mung bean soup most of the time, or a lot of the times, and really doing all of the, kind things for my body. And
Okay.
yes, last night I had ice cream, which I
Okay.
haven't had for a while. And literally within 30 minutes, my nose was running. I was feeling all stuffy this morning. My eyes were running and my nose was stuffy. And I mean, I never had that before with ice cream. So I'm wondering if, your body becomes more attuned or more sophisticated about these things, and you
Yes,
start to
yes.
recognize it more.
Yes. You start to recognize more because your body is, there is no ama in your body if you are doing frequent mung bean soup, or less ama. So your body reacts quickly, because if you're not having ice cream for long duration, and if you have it, then your body reacts to that, because it has a characteristic of increasing the kapha, and that's what happening to you. Okay.
Yeah, I was really surprised, and I knew that's what it was, but I enjoyed it anyway.
So now you can you come to know, you people come to know, oh, okay, so we have a habit that I know, in my case this happens, I know that this thing will cause this, so I'm not having that. It's like that. Sometimes you have to enjoy it, but you know the solution, what to do if I am having this problem.
Right. Very good. Thank you.
Yeah.
Okay, and I have one last question. So on that family that was coming to see you, they were having a lot of emotional stuff between them and not doing
Okay.
well. But what kind of marmas would you advise to help calm down the emotions and get them more centered and present? I know
Okay.
there's several that we've talked about here. I forget that yours
Yes,
had to do with
yes.
self-love.
Yes.
There,
Even
what
that
would you
forgive and forget marma will help him. That forgive and
forget?
forget. And what do you want to do? That this marma will help
Okay,
him. Yes.
okay.
So
Those were some I thought of. I was thinking about some of the others that I didn't know as well.
yes.
Okay. All right.
Marma is basically yes, for sometimes it's a quick fix, and sometimes you need to practice for a long duration.
It's kind of like the diet too. Sometimes
Yes.
you'll feel better right away and sometimes it's a long duration.
Yes, actually. So how many of you are coming to India? Okay, Debra is coming.
Yeah.
Cindy is also coming, right?
So,
Yes, I'm coming also. Dr.
Okay,
Ashwini.
Michelle
Yeah.
is coming. Great. I just want to know how many of from my group is coming.
It would be
I
fun to
think
meet
Mia-
everybody, you know.
Yes.
yes.
Mia is also coming. She wrote to me.
Okay.
Okay.
Cindy, I forgot where you're at.
I'm in Arizona.
You're in Arizona. Okay. And I'm in Texas. And Rochelle, where are you?
I'm in Iowa.
Iowa. Close to Nebraska, where I was born.
Well, not exactly. I'm on the other side of the state, but yeah.
Oh,
Yeah, close. I'm on the border of Illinois and Iowa.
okay. All right.
Okay.
But all of us are in the States, Lisa, Jonathan, Nora, y'all in the States? Yes.
I'm in Oklahoma.
Okay. Close
Oh,
by.
Lisa's in Canada,
Hmm.
right? Is that right? You're in Canada, Lisa?
Yeah,
Canada.
I'm in Canada.
Yeah, there's some happy things going on there right now. Whew.
Mm.
Oh, don't even talk about it.
That's for your
We'll just send
well-being.
you love.
I wish I could just escape and move to the States or somewhere else other than here.
Well, we are blessing you all for the impetus that you are making on the whole world.
Yeah.
So
Oh, thank you.
it's impacting everyone, and that is so awesome. Yeah,
Mhm. Trying to do some energy work to shift things.
yeah.
Yep.
Mhm.
Good.
That all of us?
I don't know. Any of you have idea that we have to join that main meeting after this? I don't know.
I don't know if we do. I don't
I
think.
think we're done after this
I do
today.
too. I think this is it. I have one more question, and that was, any of you maybe can answer, but that was the uploading of things into Google, like when we do our observations. Has anybody done that? I haven't done that. Like I sent Dr. Ashwini my self, evaluation directly.
No, there is, I think they give this link and they are sending it to us, and then we try to evaluate.
Okay, so I need to figure out what that
Yeah.
Google link is. Okay.
Yes, we have to upload on that link. Anyways, you can send me on the personal email also, but uploading in that link is also important.
Okay, I've got to figure that out. Okay, thank you.
Yes. Sometimes weather is also playing a role in aggravating dosha. Just a point I forgot to mention. So as per the weather also, that if there is a winter, then kapha, if you have kapha aggravated food, then it aggravated. If you have spicy food in the summer season, then this pitta aggravates. It's a different thing. In the rainy season, here we have rainy season or winter season, your vata gets aggravated. So this is all related. We have to think of many things. For example, in case of osteoarthritis or rheumatoid arthritis, the patient is normal and suddenly he's starting having the stiffness and pain because there is this rainy season is starting, or the this winter season is starting. The muscle is getting stiff, the vata is increases, the pain is starting. And in the summer season, this patient is okay. He's not having any symptoms, and again it aggravates. So this weather is also playing a major role in case of aggravating the doshas.
It's interesting that you're sharing that, Dr. Ashwini. I had clients, they're not with me now, but that in the spring, and I started noticing this over the course of a few years, in the spring, these two would always fight. It was a
Yes.
couple, it was a married couple. And in the
Yeah.
spring, they were always at each other's throats, you know, as far as fighting. And I just said to him, it's spring, you know,
Yeah,
back off a
yeah.
little bit on each other. It's spring, get yourself through
Yes,
that. But I
yes.
didn't really, you know, would this have had something to do with it?
Yes, yes,
Yeah.
yeah.
Huh. That's interesting.
So
And maybe
in
what they
few,
were eating or whatever
yes,
to go
yes,
along
in
with
a
that.
few sessions, we called it as a Rutu Chakra, that as per the season, what you have to eat, what you have to do in the this exercises, what type of this panchakarma, or what type of a regular daily karma you can do as per the seasons. This is the Rutu
Mm.
Chakra is the a different session for you. Even
Hmm.
what you have to do in the morning, that the daily, we call it as a dinacharya, the daily routine to maintain the balance, to maintain the health, is the another chapter for you in
Mm.
the coming sessions. It's very interesting. Those you have done this 100 days course might have knew this, that this type of dinacharya, rutucharya, the daily routines, and everything will be there for you.
Yeah, that's amazing. In the 100 days course, there was, I think everything was presented to us, but there was so much material. It was
Yes,
hard
yes.
to absorb it all.
Actually, yes,
Yeah.
yes.
Mhm.
So much stuff to learn.
Yes, yes. This is, I like the format of this because we have these tests and we get to study the material, and then we
Yes.
get to find out if we know the material or not, and we get multiple choice chances to figure it out if we know it, you know, and
Yes.
that kind of thing. So that's, yeah.
Yes, at least you go through the material again and again, and yes,
And more
help
opportunities to
you.
do by learning,
Yes,
you know, watching and observing and doing. Yeah.
yes. Okay.
That feels like a really big value of this, you know, because it's not pounding knowledge into our head. It's just seeing the cases and pragmatically addressing each one, which is helpful.
I agree.
Yeah.
Yes, yes.
Dr.
many
Wani,
things.
do we have a minute to just talk about OJAS?
I'm just I'm just texting Dr. Hemang that whether this is to finish this up, or we have to join the main meeting room. I'm just
Okay.
texting. He'll be back in
Okay.
2 minutes. Okay.
Okay. So I was trying to figure, you know, in that homework, they talked about OJAS, but OJAS, I was tying it into immunity, but it's not really immunity. And they had it as OJAS was like after the food is digested and then goes through all the 7 dhatus, that's when it increases your OJAS, and it has to do, but it's also the life force, and it comes out of the heart. So it's like there's multiple definitions for OJAS. And so I was trying to relate it to the Japanese or the Chinese qi, you know, but the qi, they don't talk about it going through 7 levels of dhatus and then building your OJAS. So it's kind of, it's a concept I'm not 100% getting. So what was everybody else's interpretation of OJAS?
You're getting more of it than I understood.
Well, I
Flipping
would,
through my pages now to see if I can find it.
yeah, but OJAS is immunity, but I think that's like the broad terms. And then it goes through those different stages
That
that
was my
you were talking
understanding,
about.
yeah.
But it
Mhm.
eventually ends up through the blood, right? I think is kind of what I'm getting out of it. And
I
that's
know.
why it resides in your heart, right? Because then it's through your heart, through your blood, right? Then it goes through your entire body. So I think there's parts, like you were saying, to all of it, right? To kind of get to the,
Yeah, like it's multidimensional. It's an energy thing at an atomic level coming from your heart, and then it's the digestion of all the food through the dot. I mean,
yes.
it's a very complex. Some of these concepts are very complex. If you really try to understand them, I'm like, oh
Yeah.
my goodness.
Yeah.
Well, it said what I've got here is OJAS is produced in the heart,
Mhm.
and it is immunity,
Mhm.
but it's, I mean, if you think about the immune system, it goes all through your whole body, right? And it seems like all kinds of different areas help to reduce it, you know, like exercise and eating right, and reduction of emotions, especially anxiety, and so there's lots of different things that help reduce it. I guess is it purgation? I don't know. Yeah, so it can increase with like wind. So the increase of vata can increase it too.
Increase it
Yeah,
too.
it is a really nebulous kind of thing, but when I related it to immunity, I just realized there's an immune system all through our whole body, and we have, immune centers, if you will, all through our whole body, that gather the fluids and gather the toxins and stuff, So, I mean, from that standpoint, it made sense, but now that you're asking that, it's kind of confusing. Yeah.
Yeah, I like, because I don't have a way to sit, some of you see clients and have patients now, so it makes it easier for you to do these exercises. And so since I'm just teaching nurses, I really don't have a way to sit down in front of people and do the patients thing. So I was trying to think of people that I knew for these exercises. And the emotional stuff was easy because sattva, so I have this person, Jaidev, that I love for Kundalini yoga, and he's definitely got that sattva, and then I can find the people that were all like Hamas or Rojas, those are easy to spot, right? So I could just relate to different people that I know or I'm connected to. And the people that have and decreased Agni, I can kind of figure that out, but the Ojas was a little bit harder. And when so if I was relating it to that life force energy, then it was easy because Dr. Clinton would have a lot of Ojas. So I'm trying to think. In the Ayurveda doctors, you can see the glowing skin and the energy and the life force. Hi.
Hey, I'm back. Dr. Heban conveyed that if the case study is completed, you can end the meeting.
Okay.
Yeah.
All right.
Did you want to ask your question, Deborah, to Dr. Ashwini on the Ojas?
Well, I was just trying to get the clarification of Ojas because some references said that it was once you eat food and it goes through all the dhatus, what's left over is Ojas. But then there's also the reference to immunity and like life force similar to chi. So I was trying to really, and if it comes from the heart, I was trying to really understand Ojas a little better.
Okay. So basically, Ojas is the extraction of all the good things in the dhatu. We called it as a sar bhaga. Okay. So from each and every dhatu, the extreme optimum good levels, it extracted and it comes to a Ojas. Okay. And this, when it is a combination of this sapta dhatu, from rasa
That's
to
the one
shukra.
the reproduction dhatu is what you're talking about,
Yes,
right?
yes,
The
the
bottom one.
saptada, all the 7 dhatus, the extraction of all the 7 dhatus, and it becomes the 8th dhatu. We called it as a Ojas. So ultimately, you can relate it with the immunity.
Okay.
Okay, because
it's all the levels are working
yes,
well.
yes.
So that's
yes.
why. So then why would they say it comes from the heart?
It's a concept. It's a concept because you come to know that there's a Savaha Strotas we have. The Strotas are that body channels. So it starts from that Rasavaha Strotas, the origin of Rasavaha Strotas is the heart. So that's why they are saying that it comes from the heart.
Oh, so when they map the body channels and like
Yes.
Sudaveda and
Yes.
Ayurveda, they come
Yes.
from the heart.
Yes, yes.
Okay.
Okay.
So
And
that's
if
why
you
immunity when
come to
everything's
this,
working
yes.
properly. Okay.
Yeah, yes. And if you come to see the Ojas, then you can see the aura of the person. Okay. Yes. So that is what the Ojas. So you can feel that the all Saptadhatu is on the optimum level, and that's why you have this type of aura.
Okay.
Okay. The spiritual person of this good Ojas, because they have this aura. Okay.
Yeah. because I can tell that when I look at regular people in my life, like I work in a hospital versus the Irish Shakti doctors or some spiritual people that I work with, there's an aura of a glow in the skin, a smile, a projected aura of,
Yes, yes.
I don't know if it's joy that I feel from you, but it's like there's a projected aura of something that's a higher vibration at least, right?
Thank you. Yes.
So Dr. Ashwini, if you're seeing the aura, is it the pure vibrant colors that you're seeing as the ojas? Because some people have this murky kind of aura field,
Yes.
that's sort of not good colors. And other people have
Not
these
not
bright,
it is not
luminous-
related a color. It's not related a color.
it's
Even
not about the colors.
yeah,
Okay.
not related to the skin color. Even the dark skin also has a different aura.
No, I'm talking about the auric field.
No,
It's not related to the colors in the auric field?
not related to that.
No.
No.
Okay, I thought that's what I heard you say. Okay,
No.
I'm confused now.
Yes, I'm also confused.
I know I created more confusion for everybody. You guys can go back to immunity if you want, but
Okay.
I wanted to understand why it said it came from the heart and it had to do with immunity and the 7 doctrine. So,
Yes, yes.
but
yes.
I got a better concept of it. It'll take more time to really get the true concept of it,
Okay.
practicing with seeing it in patients. But yeah,
Okay.
thank you for
But I
taking
think-
that extra time to
Yes.
answer that question.
So, yeah, and one more thing I want you to do. I think this sharing helps you for the information and to clear some concepts. And as Lisa asked me that whether there is a chart of questions. So is it possible for all of you or one of you can list that for aggravated vata, these are the questions. For aggravated pitta, we can ask this question. For aggravated kapha, we can ask this question. Okay. And for ama. So I want these 4 things that which question you can ask, and you just send it to me, not on a this group, just on a personal WhatsApp, so that I can correct them if there is any need to correct the things. Okay.
Hmm.
Would you be able to put all that together in a
Yes, and
comprehensive
then we
format?
compile it. Okay.
Okay. That would be very good.
Yeah. So I hope you are all are agree with this.
So Dr.
It's like-
Ashwini, are you wanting someone to go through maybe this recording and kind of write down the questions we heard you ask, send those to you, and you can work with that? Is that what you're asking?
No, whatever you understand regarding for
Okay.
this vata, what question you are going to ask, for pitta, what questions you are going to ask, for kapha.
Okay.
Whatever you are understanding, just let me know. So if there is a need to add something, then I will correct it, that this has to be added in your list, so that this list will be with you while you are doing the consultation. We are doing this consultation, so at least you come to know. Yeah,
Okay.
that will be helpful for your case history taking.
And then Dr. Ashwini, then will you'll share this all with all of us, or is it just one personally?
One and one, because I want to know what exactly you understand from this session.
Okay,
Okay.
got it.
So I do have one more question,
See,
because there was
why
a
I
great,
ask you not to share on a group, that then someone can copy all the things and just add on the things. So I don't want you to do it in a group, on a personal WhatsApp. Okay. And we compile the things and share it in a group. Okay.
so there's a table in our homework that said the questions to ask to see if somebody has So if you're
Yeah.
asking questions to see if somebody has would those be like specifically kapha questions then?
No.
Or
no.
would that wouldn't be specifically kapha? Okay.
The ama is different, kapha is different. So now you
Okay.
find out which question to ask.
Now I can figure out which one of these questions are really kapha and vata, but okay.
Yes, yes.
All right.
Okay.
Thank you.
So this is homework for you, and let's meet next one with another session. Okay.
Okay.
And
you.
whatever your feedback, just write it to me. If you want some different information in these sessions, or shall we continue this type of case study, just whatever you feel, you just write it to me. Let's see how we can improve the next session. Okay.
Okay.
Okay. Good to see you all, and very happy to share all this case study of mine with you. Okay.
Thank you.
Thank you so much.
so much,
Bye.
Dr.
Take
you,
care.
everyone.
Bye,
Thank
everyone.
you.
See you
Bye,
next time. Bye,
everyone.
Lisa. Bye,
Bye,
Jonathan.
everyone.
Bye, Rochelle.
Bye.
Bye, Cindy. Bye, Nora.
Bye.
Bye.
Bye.